How's it going, guys? It is 1:01 a.m. Tuesday, April 26th here in Japan, and we have an easy immunology slash pediatrics question. It's not every question I make has to be dramatic or crazy, right? I mean, the point is to increase your score, right? So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. I really appreciate it. Find me on Instagram at Mehlman_medical, MEHL_medical. Link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. And now let's start the question. 9-year-old boy had fever and migrating polyarthralgia for 3 days. Examination shows a serpiginous rash, just a fancy word which means snake-like. His left knee is swollen. Cardiac examination shows a 3-on-6 whole systolic murmur, heard loudest at the apex. This is mitral regurgitation. The mechanism responsible for this patient's murmur is most immunologically similar to which of the following? So this is rheumatic heart disease, okay, easy, as I said, and colloquially, this is Jones, Jones, so J is joints, polyarthralgia, okay, painful joints, the left knee is swollen. O, supposed to look like a heart, so carditis, are mitral regurg acutely, mitral stenosis later in life, that's really important. N, you can get subcutaneous nodules. E, erythema marginatum, which is a snake-like serpiginous rash. S, Sydenham chorea, which is autoimmune response of the CNS, which can cause a movement disorder. So it's when strep pyogenes, we have antibodies that form against strep pyogenes M protein, which via molecular mimicry cross-react with the mitral valve. It's a type 2 hypersensitivity, okay? So let's just walk through the answer choices here. Choice A, anaphylaxis, wrong fucking answer. It's type 1 hypersensitivity. This is when we have antigen binding to the Fab region of IgE on the surface of mast cells and basophils. The IgE come into close proximity with one another, cross-link, mast cells, basophils degranulate, release histamine. You can get low blood pressure, swelling, dyspnea, okay? And you treat with intramuscular epinephrine. Wrong fucking answer. Choice B, heparin-induced thrombocytopenia. Correct answer. It's type 2 hypersensitivity. Okay, so this is when you have antibodies against your own cells. Platelets are cells. Okay, so antibodies against your own cells, receptors, tissue in any regard. So for whatever fucking reason, some patients who receive heparin, they can develop antibodies against the heparin platelet factor 4 complex. Okay, heparin hyphen PF4 complex. It's type 2 hypersensitivity, okay? You should also be aware of Graves' disease, pernicious anemia as high-yield type 2 hypersensitivities. Choice C, serum sickness, wrong answer. This is a bit nebulous, difficult. This is when you have a viral infection such as Hep B, Hep C, rubella, can be reactive arthritis such as due to chlamydia, where you get arthritis 3 to 7 days after initially contracting the infection. This can also be due to receiving a drug where 3 to 7 days a patient gets polyarthritis, okay? It's type 3 hypersensitivity. It's antigen-antibody complexes. This is not to be confused with Arthus reaction, which is an injection of a drug or vaccine where a patient gets a localized skin reaction at the site 3 to 7 days later. So, for example, the COVID vaccine, Moderna, colloquially caused Moderna arm, which would give people redness at the site of the vaccination 3 to 7 days later. So that's Arthus reaction, okay? Serum sickness, Arthus reaction, post-streptococcal glomerulonephritis, and also the malarash for lupus, high-yield type 3 hypersensitivities. Wrong fucking answer. Choice D, tuberculin skin test, aka PPD skin test or Montel test. Wrong fucking answer. This is type 4 hypersensitivity. This is the TB test, right? So this is T cell response, all right? So you're going to have the macrophages within the skin. They are going to phagocytose the tuberculin antigen, present it on MHC2 to CD4 plus Th1 T cells, okay? So T cell response, type 4 hypersensitivity. So not only the PPD test, but also contact dermatitis, very high yield. Rubber, okay? Contact dermatitis from weeds, poison ivy, poison oak, poison sumac, very high yield, okay? So wrong fucking answer, but nevertheless, I mean, these immunological distinctions, very high yield for USMLE. You know the deal. I'm going to continue to make more content. If you like my stuff, subscribe to my channel. I appreciate your time. That's it.